Good evening. Welcome and thank you for joining the Napa Opioid Safety Coalition's Fentanyl Awareness Town Hall. The Napa Opioid Safety Coalition is a local collaboration formed to transform the health of the Napa communities by leveraging partnerships to prevent opioid addiction and support substance use treatment through safe opioid prescribing, harm reduction, education, and easy access to treatment. Tonight, with our partners at the Napa County Office of Education, we aim to focus on overdose prevention by raising awareness about fentanyl poisoning, a part of the opioid epidemic that has significant impact, particularly for teens and young adults. This evening, we hope to improve your understanding of the drug fentanyl and the dangers associated with its increasing presence in our communities. We have a panel of presenters to discuss various aspects of this substance and discuss why fentanyl awareness is important right now in the Napa communities. We will follow the presentation with a discussion in a Q&A format. Thank you again for joining us. Now I'm going to give a brief introduction of our panelists and their topics. The slides that we'll present have further details that will familiarize you with our speakers. Mona Leonardi. Ms. Leonardi is the co-founder of the Michael Leonardi Foundation, an organization based in Napa that is dedicated to increasing awareness about illicit fentanyl across the community in the North Bay area. She's going to share with you a very personal story that highlights the importance of increased awareness and action to decrease devastating effects of fentanyl poisoning. Dr. Ninada Tali is a family physician and addiction medicine specialist who works at Kaiser Permanente, offering treatment for substance use disorder and teaching young clinicians about addiction and overdose prevention. He's going to give us a brief overview of the substance fentanyl and where this substance fits into the fentanyl poisoning, substance use, and opioid use. Sheriff Oscar Ortiz is a 26-year veteran of the Napa Sheriff's Office. He was appointed as sheriff in 2021. Sheriff Ortiz supervised the Narcotics Task Force from 2008 to 2012 as a sergeant and has taught narcotics enforcement at the Police Academy for 7 years. He's going to give us a perspective about how substances and forms of illicit substance use affect our community as well. Mr. Paul Kuhn is a coroner civil sergeant in the coroner division of the Napa Sheriff's Office. He's going to offer some information on the trends and data related to opioids and overdose rates from the coroner's office perspective. Allison Haley is the first woman to serve as district attorney in Napa County. She was appointed by the Board of Supervisors in 2016 and was elected to that position in 2018. She's a 2001 graduate of UC Davis Law School. She holds a law degree and a master's degree in criminal justice and a bachelor's degree in philosophy and social science. Today, she's going to review for us some of the laws related to fentanyl and substances in our community. Nyla Francis is an emergency medical services specialist with the Napa County EMS agency. She has worked within the 911 system as an EMT and paramedic. In these roles, she has experience in administering Narcan in the community to treat opioid overdoses. She will share with us how Narcan is given to reverse the effects of fentanyl and prevent death from an overdose. Dulce Murillo is an OAD at Aldea, a local nonprofit that focuses on improving the mental health of young people and families through community-based education and counseling services. She's going to share with us how we can talk with kids about and young adults about substances, how we can help prevent substance use, and also avoid fentanyl and mental health problems. So our first speaker will be Mona Leonardi.
Good evening. My name is Mona Leonardi. I'm Michael's mother and co-founder of the Michael Leonardi Foundation, along with Michael's dad, Mark, and Michael's sister, Julia. Thank you for attending this important town hall on the danger of illicit fentanyl and fake prescription pills and ways to keep our youth and community safe. We tragically lost Michael on February 24th, 2020, from fentanyl poisoning, at the age of 20 years old. Fentanyl is a synthetic opioid that is extremely powerful. It is up to 50 times more potent than heroin and 50 to 100 times more powerful than morphine. Legally, it is a drug used to relieve severe pain in a hospital setting and administered by a licensed doctor. Illegally, it is being used in street drugs by drug trafficking organizations and dealers. It is extremely dangerous and lethal when on the street and is highly addictive. Michael ingested what he thought was a Percocet prescription pill. What was actually given to him was a fake prescription pill that looked real and contained a lethal dose of fentanyl. He didn't know that the pill he was about to ingest was fatal. The person that sold it to him on the social media platform Snapchat did not disclose this information and deceptively sold Michael a fake lethal pill. This person was actually a drug dealer that was easily found on Snapchat, and his profile had hundreds of likes and drug emojis. This purchase was made with the push of a button and delivered immediately. Michael grew up in Napa and was living in San Diego attending college. He was in a good place in his life, living by the beach with his housemates and his sister close by. He had an internship for a social media marketing company that he really enjoyed. He was a gifted guitar player, was very social, and had many friendships. Michael ingested this fake pill on a Sunday evening while watching a movie with two of his roommates, and they found him unresponsive the next morning. It was too late. Fentanyl had shut down his respiratory system and he stopped breathing. The toxicology report we received 6 weeks later showed no oxycodone from a Percocet pill in Michael's system, only fentanyl. He was poisoned. I believe he took this pill for relief of his anxiety and was self-medicating. This poisoning didn't happen to just Michael. It has happened to thousands of other victims, as young as 12 years of age, that are unaware they were given fentanyl in a fake prescription pill, cocaine, heroin, or other street drugs like meth, and this continues to happen on a daily basis. Drug trafficking organizations are able to purchase fentanyl precursors easily from suppliers and press into pills using a pill press. They shape, color, and stamp these pills to look like the real prescription pill, like a Percocet, Xanax, or Adderall. Fentanyl is cheap. You don't have to grow it like cocaine or heroin. Not much has to be used because it's so potent, and it's easy to transport. But these drug traffickers are not trained in how to dose fentanyl, and they don't know how to mix properly and have no quality control in the process. This results in pills that have lethal doses of fentanyl. They are making huge profits from this deception and taking the lives of our children, siblings, and loved ones, and are getting away with doing so. Teenagers and young adults are easily purchasing these fake pills through social media outlets like Snapchat or getting through friends that are buying online. The ease of purchasing these fake pills is at the push of a button and delivered to your doorstep, and they have no idea what they're getting or the immediate danger. It only takes 2 milligrams of fentanyl powder to kill an average-sized adult. That extremely small amount fits on the tip of a pencil, and there's no way to tell the difference between a real or fake prescription pill in the illicit drug market. The Drug Enforcement Administration has tested seized counterfeit pills, and 2 out of 5 are lethal doses of fentanyl, or 40%. 98% of the pills in the illicit drug market are fake. In a 1-year period ending September 2021, approximately 70,000 deaths occurred in the US that were fentanyl related. That's 70,000 people died in that 1-year period from fentanyl being in the drug supply. A fentanyl death can happen to anyone that is purchasing illicit drugs. There's no discrimination. Deaths are occurring to first-time and recreational users. That includes teenagers and young adults, along with those with substance use disorder. The #1 cause of death for the age group 18 to 45 since 2020 is from fentanyl. We hope this evening provides important information for you to talk openly to your child or loved one about the danger of illicit fentanyl in the drug supply and knowing the signs of an opioid overdose and having Narcan available to help save a life. Thank you.
you, Mona. Now we'll move to Dr. Atali.
Good evening, everyone. Thank you for being here to learn about this important issue. My job is trying to give you the basic information about fentanyl in 5 minutes, which is not a lot of time, so I'll get right into it. So I want to start with a study that came out recently that showed that teen overdose deaths are rapidly rising, even though not more of them are using drugs. And what this study looked at was the number of 10th graders who reported using any illegal drugs over the past year. And that number was around 30%, which still may be shocking to many of you. That number has actually stayed the same over the last 10 years and gone down, in fact, in 2021 to less than 20%. Between 2011 and 2019, the number of overdose deaths among adolescents, this time looking at teens aged 14 to 18, has been relatively constant at around a rate of 2 per 100,000 teens. However, in 2020 and 2021, this number more than doubled. So what could explain the fact that while less teens are using drugs, more of them are dying? The answer is one word: fentanyl, which is a type of opioid, which I will talk about. So first, what are opioids? Opioids are a class of medication that work on the opioid receptor in the human body. And opioids can be naturally occurring chemicals that come from opium, like morphine, heroin, hydrocodone, and oxycodone, which are slightly modified opioids that are present in common pain medications. Opioids can also be synthetic, including methadone and fentanyl. So fentanyl is a synthetic opioid that was first created in 1959. It is 100 times more potent than morphine. And why is fentanyl useful? Because having a powerful medication like this can help doctors more effectively treat pain in certain situations, for example, during surgery or during severe trauma. So what do opioids do? Opioids bind to the opioid receptors in the human body like keys opening different locks. And depending on where those receptors are located, opioids have the following effects. They relieve pain, cause drowsiness, euphoria, or that feeling of feeling high, slowing breathing down, slowing the heart rate, and constipation. And opioids are dangerous because the combination of drowsiness and reduced breathing can lead to overdose and death. So why are opioids so addictive? This is a little bit of a trick question because addiction is actually a complex disease with many factors: biological, psychological, and social. Opioids, in my opinion, are not the cause of addiction. They're dangerous because of their overdose potential, and they're very hard to quit because of two very important concepts: tolerance and withdrawal. Tolerance basically refers to the fact that as you use a substance for long periods of time, you need more and more of that substance to have the same effect. In fact, most opioid users will tell you that after a period of time, the opioid doesn't have any kind of a beneficial effect, but in fact, you need high doses just to feel normal. And that brings us to the concept of withdrawal, which means as your body has developed that tolerance, when you don't have enough of that drug, you will experience symptoms opposite of the effects of intoxication. And in the case of opioids, these symptoms include pain, dysphoria, anxiety, restlessness, vomiting, and diarrhea, and other unpleasant symptoms. Why is fentanyl so dangerous? Fentanyl is dangerous because it's so potent that very small amounts and very small differences in the amount of fentanyl in a drug can be the difference between life and death. It often contaminates other drugs like fake Xanax and fake methamphetamines. In fact, when you hear about bad batches of drugs, it's usually an inappropriate contamination of fentanyl in those drugs. And this means that people who are not used to opioids and using other drugs may accidentally be exposed to a very dangerous dose of opioid. And sometimes opioid users actually seek out fentanyl. As people spend more time using, they develop tolerance and start seeking stronger and stronger medications to get the same effect. Once people start using fentanyl, however, the withdrawal symptoms are much worse, and it can be much more difficult to quit. So what can you do? How can you help? You're doing a lot just by being here and learning about the problem. And you'll learn more about naloxone and more about services in Napa County that can help those struggling with addiction. If there are any questions, please send them to me, and I'm happy to answer them as much as I can. I want to spend a minute here at the end of this presentation just talking about treatment. Addiction is a very complex and hard thing to talk about for many people, including people like me who spend their entire day trying to help people with addiction. And I often find it useful to use metaphors when thinking about these things. Contrary to what many people think, recovery and sobriety are not natural to many of those who struggle with addiction. They're skills that need to be learned, just like riding a bike. No one is born learning how to ride a bike. It takes practice and patience. It takes learning how to balance, learning how to train certain muscles to perform certain actions at certain times. It can also mean falling down sometimes. Learning how to be sober is similar. However, when we talk about fentanyl, falling down can mean having something very bad happen, like overdose and death. In this case, it's very important to understand that medications are an essential part of treating opioid addiction. When we talk about medication-assisted treatment, or MAT, this refers to using two very specific medications, Suboxone or Methadone, to help people recover from opioid addiction. And you can think about these medications as training wheels to help someone ride a bike. Training wheels help people learn how to develop their strength and balance, feel normal, and more importantly, keep people from falling down until they're ready to ride. In the future, I hope I'll have the opportunity to talk to you more about medication-assisted treatment. In the meantime, I've said please send me any questions you have. Thank you for your time. I hope you get a lot out of being here, and thank you again for being here to learn about all this.
Thank you, Dr. Atali. And now Sheriff Ortiz will share with us.
Thank you, Colleen, and thank you everybody for joining us, and share my screen here. Can you see my screen?
Yes.
Okay. Yeah, thank you again. My name is Oscar Ortiz, Napa County Sheriff. I want to talk to you a little bit about what's going on specifically here in our region here in Napa. First off, we see a lot of news about fentanyl, and we have a lot of concern, as we should. As you heard from Ms. Lenardi, it's 2 milligrams, the tip of a pen or tip of a pencil can be a fatal dose. So it is a very, very dangerous drug. However, I want to let everybody know that our biggest drug problem in our region is still methamphetamine. We have seen some fentanyl cases, and I'll give you some examples, but we're not what you see when you turn on the national news and you see what's going on in Connecticut or Ohio and some other states that are seeing a lot of huge amount of overdoses and deaths and poisonings. So I'm trying to get this thing slides forward. One of the questions we get asked quite a bit is how can we tell if a pill that we bought on the black market has fentanyl in it, or if it's a legitimate prescription pill? And really, there is no good answer for that. If it's a pill that was purchased on the black market, the best thing to do is to assume it might have fentanyl, because we're seeing more and more of that across the country. The ability to counterfeit traditional prescription pills of abuse, or prescription pills that are circulating on street drug dealing, the counterfeitability of those is pretty phenomenal. And so it's really not fair to try to say, well, this is what you're looking for. You see on this slide, there's an example of an authentic and a fake, and there's really no way for a user, somebody maybe it's suffering from substance abuse, as the doctor mentioned before me, to be able to decipher which one is going to be real or not. They can come in pills, pure powder, mixed with other drugs, is something we've seen here in Napa from time to time. And then there's the fentanyl patches. One thing we've seen a couple of times now, as a matter of fact, we had a case yesterday, is popcorn. So you see in the picture, there's a piece of popcorn there that's actually got fentanyl. So, does that mean we run from the movie theater or run from popcorn? No, but if you come across a coin bag or a small plastic bag that's got one kernel of popcorn in it, that's not how popcorn is packaged. That's not how popcorn is usually found. So that should be treated with lots of suspicion. There could be plenty of fentanyl for a poisoning or overdose on one nugget of popcorn, as you see in that picture. There is no honor amongst drug dealers, and I think our DA is going to speak a little bit about something they're doing, but there is no code of conduct or truth in advertising in the drug dealer community. Oftentimes, drug dealers may not even realize that the product they're selling, which they're middlemaning because they bought it from their supply, they may not realize that it has fentanyl in it. One red flag we tell people is if it's being marketed by the drug dealer as enhanced or a better version of the common drug they deal. A super meth or something like that, or super cocaine, or if there's any marketing by the drug dealer on the black market about how it's a good batch or it's a better batch, that's a big red flag that there's probably some fentanyl that's been introduced to that. Again, our biggest drug problem in our community is still methamphetamine, but we know that there's been levels of fentanyl in some of the local methamphetamine. The more common one also, especially with young people on the purchases through different social media platforms, is counterfeit prescription medications. And really, prescription medications should come from a prescription container that comes from a pharmacy. So any black market prescription medication is likely to have levels of fentanyl in it. That's really all I have. I'm gonna stop sharing here, and then I'll be around for some questions. Thank you.
So much for that really useful information. And now we're going to hear from Paul Kuhn.
Good evening, everyone. I'm Paul Kuhn with the Sheriff's Office with the Coroner Division. Real quick intro to some of the cases that the Coroner's Office is in charge of per 27-491 of the Government Code and 102-850 of the Health and Safety Code. All sudden, violent, unusual deaths resulting from accidents, suicides, homicides. I won't go down the whole list, but that list also includes deaths due to poisoning, starvation, drug addiction, aspiration, alcoholism, sudden infant death syndrome deaths, and unattended deaths. We went over some statistics as of 4/15, so last week. Our numbers are constantly changing. We have multiple open cases still from the year 2021, so bear with us, these numbers will change. But as of last week, we had from 2018 through 2021, approximately 46 coroner's cases, which resulted from fentanyl and or opioid related deaths. I want to concentrate on mainly last year for 2021, but out of those deaths, we had approximately 6, which were acute fentanyl intoxication deaths, whether from overdose and or poisoning, and we had double that, which were from methamphetamine. So methamphetamine still is a large problem for us. Multi-drug overdoses are still our most common norm as opposed to individual. That being said, for 2021, we had approximately 16 deaths, which were opioid related. 2 of those were fentanyl only acute intoxications. Approximately 3 of those were opioid without fentanyl. And the other 11 also included fentanyl. So out of those 16, 13 of them did have fentanyl as some part of their toxicity level. The overwhelming majority, approximately 4-to-1, we're dealing with male as opposed to female for our decedents. The majority are white males, and over 50% of these either overdoses or poisonings, as I said, either way, are occurring within person's own residence. Obviously in the county of Napa, the majority of our population is in the city of Napa, and that's where the majority of our decedents are located. Thank you very much. Appreciate your time this evening for people logging in.
Thank you for those eye-opening details. We appreciate the information. It's helpful to put the national statistics in context in our own community. Now we'd like to hear from Allison Haley to talk about our legal response to some of these interesting statistics.
Thank you. Thank you. I'm so grateful for Sergeant Kuhn and for our Napa County Sheriff for providing that information that really allows us to contextualize the problem as we see it here in Napa County. My name is Allison Haley, and I am the top prosecutor here in Napa. The influx of fentanyl into our community gives me great concern. I strongly believe, and the data bears out, that many victims have no idea they are ingesting deadly amounts of fentanyl until it's too late. And to me, as a criminal attorney, that makes their deaths the result of a poisoning and not of a volitional, if unintended, overdose. I think that the words that we use when it relates to fentanyl become very important. Fentanyl's presence on our streets, even here in Napa, is the result of drug dealers and their selfish choices. It's not more complicated than that. They add it to their drugs to increase their profits and to drive addiction. And it's nothing more complicated than greed compared with an utter lack of regard for the safety and health of others. And I think that what the sheriff was alluding to are some of the things that we've been doing here in Napa Superior Court to address that stark reality of the mindset of the drug dealers that we have been seeing here in Napa County and that we see across the country. So in 2021, the Napa County District Attorney's Office, under my leadership, took a position that if you are selling drugs in Napa County and someone dies as a result, we are willing to review that case for charges of implied malice murder. And that is a very different position than other district attorneys' offices have taken. And it's a different approach to the consequences of drug dealing in the United States. So we've been kind of doing this kind of thing for years, but in a different kind of case. So let me explain that to you, and hopefully you'll understand how it relates to fentanyl cases. So in the world of DUIs, driving under the influence, criminal prosecutors will give defendants what we call a Watson warning or a Watson advisement. It's named that because of some case law. And what it does is it basically puts a convicted person of DUI on notice. It says, hey, driving while under the influence is very dangerous. And if you continue to choose to drive a vehicle and as a result, someone dies, you can be tried for their murder. You may not have wanted to kill someone, but you chose to be engaged in that wildly dangerous behavior, and therefore you're going to be held accountable for it. The most recent prosecution on one of these Watson murders was a tragic DUI that took place in American Canyon. Right there on Highway 29 and Eucalyptus, kind of right in front of the American Canyon Walmart, where the defendant had had 3 prior DUIs, and on his 4th DUI, struck and killed a woman, and we prosecuted him for what we call implied malice murder. So let's go back to what we're doing with fentanyl. In the world of fentanyl, we have begun to give an advisement to defendants convicted of selling any kind of drug in our county, because as you've already learned, people are cutting fentanyl into cocaine, and they're cutting it into methamphetamine, and they're cutting it even into marijuana. Sometimes the drug dealers may not even know that it's been cut into their product. It doesn't matter. The defendant is put on notice that if you're selling drugs in our community, that some of it may contain fentanyl, and that fentanyl is deadly, that fentanyl can kill you with only a very, very small dose. And that if you are selling drugs in this country and someone dies as a result, you have placed yourself in jeopardy of being charged with murder on an implied malice theory of liability. DA's offices around the state are beginning to give these advisements. Napa County has not yet charged anyone with murder on this theory, thankfully. We are seeing these cases most recently filed in Riverside County and closer to us in Placer County. But I'm going to be the first to tell you, we are not going to prosecute our way out of this kind of problem. While I believe that prosecutions are important for accountability and justice in individual cases, they are difficult from an evidentiary perspective, and they have very mixed results of affecting real change on the street. So I don't want you to think that I'm a one-trick wonder, that it's only about advising them or giving that fentanyl warning. We need a multi-pronged approach. The district attorney's office is partnering with Health and Human Services to explore the idea of Narcan vending machines. They have them in Marin County. They have 2 of them. It offers free Narcan doses with instructions in both English and Spanish. They are practical, visible efforts to get doses into the hands of those who need them most. Marin has chosen their jail's lobby as a good place for distribution. They are reporting about 20 kits, Narcan kits, are taken every week, just from that one location in the jail lobby. I know that Ms. Leonardi and I have discussed getting Narcan kits into the hands of parents. of high school age children. That is something that we're exploring as well. And finally, the district attorney's office is committed to drug treatment and mental health treatment. We staff drug court, we staff a mental health court. We regularly come to agreements with defense counsel to resolve cases with an eye toward court-ordered drug treatment and terms to incentivize defendants to keep their mental health appointments, to comply with medications. Probation is not here to weigh in, so I want to toot their horn for a moment. We have an extraordinary team at Napa County Probation who celebrate every success of a probationer while holding them accountable as they work their way to sobriety. And I know that prosecutors many times were seen as though I only like to send someone to prison. It's far from the truth. Sometimes prison is appropriate, but the vast majority of cases in Napa County result in defendants remaining in our community and are in need of service. And investment in mental health and addiction services is absolutely an important component in our community's response and in the response that you can expect and deserve from the district attorney's office. Thank you.
Ms. Haley, we really appreciate that multi-pronged approach and the multifaceted issue at hand with opioid use, fentanyl poisoning. And I'd like to now move to Nyla, who's going to talk about that really important tool of Narcan to help prevent opioid overdose deaths. Thank you.
Perfect. Thank you, Colleen. Hi, everybody. I'm Nyla Francis. I'm going to go ahead and share my screen. Give me 1 second. Okay. We should be in presenter mode. Let me know if I'm not. Okay. So I work here in the EMS agency for Napa County Public Health. I'm a paramedic by trade. I worked in the field in EMS for about 13 years and have given Narcan quite a bit. So that's really what I'm here today to do, is to explain how to give it and when to give it. I'm going to try and do this in 5 minutes. Okay, so here's our objectives today. I'm really hoping just to demedicalize this as much as possible. So we're going to go over what Narcan is, how do I recognize an overdose, and then what are the steps to giving Narcan. So very simply, also known as naloxone, it blocks the action of opioids at the receptor sites and reverses respiratory depression. So this green circle in the middle here is your opioid receptor site, and then the orange triangle is the opioid binding to it. And then when you give Narcan, it displaces it. And you should see the effects of Narcan very quickly, within a couple seconds to a minute. You should see the breathing change or get better. So that's what Narcan is. But more importantly, how to recognize an overdose. So the biggest sign you're looking for with an overdose is ineffective or poor breathing. So you're looking for slow, shallow breathing, sometimes gargling, gasping, or snoring sounds. Those are indicators. So the other signs that go along with an overdose are skin. So you're looking around the lips and the fingers, you're looking for gray or blue. So if you have a darker complexion, this is going to present more gray. But if you have lighter skin, this is going to present more blue. And then, of course, responsiveness. So somebody who is entirely unresponsive or very decreased level of responsiveness. But again, I just want to emphasize breathing. That is what Narcan is going to fix, or should fix. So one thing I wanted to, there's a little caveat to this, is knowing when to do CPR. So if you don't see the person breathing at all, please start CPR right away. And of course, call 911 so you can get EMS going to your location right away. So I just wanted to go over this briefly. So if you don't see any rise and fall of chest, or you're not sure if they're breathing, just go straight to CPR. And hands-only CPR is very simple. You put one hand over the other and you press hard and fast in the middle of their chest. Okay, so I just wanted to digress into that quickly. What are the steps to giving Narcan? So I broke it down here in just to 3 simple phases. So you're checking for responsiveness and calling 911. I like this picture here. It's a cell phone. And they have the 911 dispatcher on speaker, which is great because it leaves you hands-free, and then you can actually take care of the person. So you're checking for responsiveness, you're trying to arouse them or wake them up, and then calling 911. This is kind of done simultaneously. If you suspect an overdose based on those signs that we just went over, go ahead and give the Narcan. I'm going to show a video on exactly how to give it. And then what you're going to do after that is place the person in recovery position. So if they end up vomiting, this kind of protects their airway, but we'll also go over how to do that. So let's say you've gone through all of those steps and you see no change, their breathing doesn't improve at all. Wait about 2 to 3 minutes and you can give another round of Narcan. It's a very safe, benign medication to give. Okay, so I have a little video. It's 2 minutes. It goes over all of the steps we just covered, and then it shows actually how to give it and pushing the plunger. If you've ever taken Flonase for allergies, you can give Narcan. It's really just that simple. One thing I don't like about the video, they call 911 much later. Please call 911 right away. EMS has a lot of Narcan and a lot of other things that they can do to help the patient. So make sure 911 gets called immediately. Okay, and here's the video.
If you encounter someone who is unresponsive and you suspect an overdose, first shake their shoulders and shout their name.
Kevin.
Ask if he or she is okay.
Hey, can you hear me?
Check for signs of an overdose, unresponsive to touch or voice. Breathing is slow, uneven, or has stopped. Snoring, gasping, or gurgling sounds. Fingernails or lips are blue or purple. Administer Narcan nasal spray as quickly as possible if someone is unresponsive and an opioid overdose is suspected, even when in doubt, because prolonged respiratory depression may result in damage to the central nervous system or even death. Lay the person on their back to receive a dose of Narcan nasal spray. Remove Narcan nasal spray from the box. Peel back the tab with the circle to open it. Remove and review the printed quick start guide inside the package. Hold the Narcan nasal spray with your thumb on the bottom of the plunger and your first and middle fingers on either side of the nozzle. Do not press the plunger to test or prime the device. If you do, you will waste all or part of the dose of medication. Tilt the person's head back and provide support under the neck with your hand. Gently insert the tip of the nozzle into one nostril until your fingers on either side of the nozzle are against the person's nose. Press the plunger firmly to give the full dose of Narcan nasal spray. Remove the device from the nostril after giving the dose. After you have given this medication, seek emergency help right away. Narcan nasal spray is not a substitute for emergency medical care.
I'm with somebody who stopped breathing. I think they've had an overdose.
Move the person on their side after giving Narcan nasal spray. If possible, put their hands under their head and bend their upper leg forward. This helps prevent the person from rolling onto their stomach. This is known as the recovery position.
Okay, and then my last slide here. So I just have some additional considerations. So Narcan is a very safe medication. As I was saying, it's very benign. If you're in doubt, you're not really sure, just go ahead and give it. There's really not a downside to giving it. It's very safe. So again, poor breathing is the most important indicator to be looking for. The person can wake up agitated, combative, sometimes violent, or vomiting, sometimes all at the same time. So those are things to be aware of. There can be safety concerns with giving the medication. And then sometimes you're going to need more than one dose depending on how much opioids are in their system. So I hope that was easy to follow. And I think we're doing questions at the end, but I will be on to answer any questions. So thank you, everybody.
Thank you, Nyla. That was really informative, and the step-by-step video was really helpful. Thank you so much. And now we're going to ask Dulce to come forward and speak about some of the preventive techniques and some of the other resources we have in Napa to help prevent these events.
Hello, everybody. Let's see. All right. So I am Dulce Murillo. I'm an AOD counselor with Aldea. Today I'll be talking about our services and tips how to talk to your children. How to talk to your children about drugs and alcohol. For youth in middle school and high school, it's important for you to talk to them about long-term consequences, whether it be legal consequences, them being on juvenile probation, health consequences as well, how it's going to affect their lung functions with substance use, their liver function, things like that. Also specifically discussing consequences at home. It's important for them to hear from you. What are the consequences that are going to happen at home? Because if they don't hear from you, they will just assume and talk to friends and say that consequences that their friends are receiving might be the same at home. So it's important that they know your stance at home as well. A lot of children also say that they use substances because of boredom, having a lot of free time. So it's important to involve your children into extracurricular activities, sports, clubs, things that will reduce their free time. Also helping them identify those stressful situations, whether it be parties, schools. A lot of youth nowadays say that they're using substances in the bathrooms in school. So helping them identify those situations and how to get out of those situations as well, and talking to them about a buddy system as well. Having another friend that is going to be able to say no with them, so they don't fall into that peer pressure of wanting to use substances. Tips to prevent alcohol and drug use as well. Choosing empathy and having open communication with your children is very important. Being ready for them to have those conversations, and you being a resource for them. So if they do have questions, they're able to talk to you and feel comfortable coming back and having these conversations with you. Because if they're not able to have them with you, they will be having them with friends. And again, those friends' conversations are not 100% accurate to what is actually happening. They are going to talk about how substance use is great, when in reality, it's affecting them in negative ways. Choosing an appropriate place and time to have conversations with your youth is also important. One of my favorite places to share is in the car. If you're driving with them and just having conversations with them, maybe they don't have to reply, but they're at least listening to you. This conversation is also not a one-time thing. It's a continued conversation, identifying times that are stressful for your youth and having these conversations with them. One of the biggest times that is stressful for youth is those transitions from elementary to middle school or middle school to high school. They're changing a lot of things in their lives. It might be really stressful. So identifying those times where you can tell that there are changes that are happening, losing friends, changing friends, relationship problems, school problems. Those are great times to have these conversations with your youth. And also, talking to them at different levels as well. When they're younger, talking about the dangers of it. Later on in life, talking about the peer pressures, and having those conversations in that way. Also be very mindful of your own personal use. There's a lot of youth who say mom and dad drink and mom and dad will drive afterwards. So in that moment, drinking and driving is not as dangerous to them anymore. So making sure that you are aware of how you're using and how often you're using in front of your children, and setting those expectations with your youth. What is going to happen if they use substances? What kind of resources would you provide to them? What does the home look like afterwards if there is substance use, and trust how it is affected? Some of our prevention services, we have prevention services in all middle schools and high schools here in Napa County that extends from Calistoga all the way up to American Canyon. For the most part, we are located in the wellness centers, and a lot of youth are able to self-refer. So here in these groups, they happen during school time. They are confidential, which means that we cannot confirm if a youth is in group or not. They would receive alcohol and drug education. We talk to them about coping skills to reduce substance use if they are experimenting. We also talk about stress and how to manage it, peer pressure. And fentanyl is also a substance that we've recently introduced into our curriculum as well, that we talk to our youth about. These are free groups, confidential at school. And like I said, for the most part, they can self-refer. Sometimes we do have youth that get caught on campus using substances, and they will also get referred to us as well. Besides prevention services, we also have treatment services, and that is for youth who are already using substances and are struggling to reduce use on their own. The eligibility is for any Napa County resident ages 12 to 21. We accept all insurances, and we have a sliding scale available as well. We offer individual and group outpatient counseling services, urine analysis testing for the 4 instant panels, which would be cocaine, methamphetamine, THC, and opioids. We can also do lab testing for alcohol or THC levels or other substances that might be using as well. We offer family support as well. So the family is involved. If they happen to be on probation, we kind of do that all around services with them as well. And we have recovery services for once a youth has successfully been able to reduce their use and are in recovery, we still are able to offer them that support after. And they're able to stay in recovery services for a while afterwards. And then if they end up relapsing or using again and wanting support to reduce use, then they can come back into our treatment services as well. Here is our contact information. Again, I will also be sticking around if you have any questions, so we could check those out at the end. Thank you.
So much for that really useful information. And this concludes our panel portion. Mona, did you want to wrap us up with a few words of wisdom? Call to action?
Yeah, thank you. So how do we address this fentanyl crisis in our community? So we need to have urgency in raising awareness and educating youth and the community and providing information to make informed choices. 35% of youth ages 13 to 17 say they don't know enough about fentanyl and its danger, and 73% have never heard of fentanyl and counterfeit pills. If a pill doesn't come from a licensed doctor or legitimate pharmacist, don't take it. Don't take any pills you get from a friend. Assume they are fake. Know the signs of an opioid overdose and have naloxone available. The stigma around substance use needs to end. When people feel stigma or judgment, they don't tend to seek help. We need to listen with no judgment and have compassion. Schools, both middle and high school, and college students need to have fentanyl awareness as part of their drug and alcohol curriculum. This should include awareness posters in campus, like at student services around in areas and in bathrooms, and presentations in health classes, school assemblies, youth groups, and PTA meetings. Our youth should be having peer-to-peer discussion groups on this topic and discuss ways to help friends when they need it, and to be aware of the dangers of purchasing illicit drugs on social media and online. Our family is devastated and forever changed by Michael's loss. We miss him terribly and do not want to see other families go through this tragedy. Now that you've heard this important information from our panelists on illicit fentanyl, we'll move to our Q&A part of the town hall. Thank you.
First question, how can you tell if a pill is counterfeit?
Thanks, Colleen. I can take that one. And really the only way to tell is to send it off to a lab with sophisticated equipment and highly trained scientists to analyze the compounds in that pill to identify if it has fentanyl. So that's just not going to happen. As I mentioned earlier in the presentation, if it's not coming from a pharmacy, you should assume it may have fentanyl. The counterfeiting skills are very high, very good, and they will look very legitimate. But if they're purchased on a social media platform, there's a good chance of a poisoning. The other thing I'd also mentioned is if there's extra marketing from the drug dealers, like, hey, this is a really good batch, or this is enhanced ecstasy, or this is stronger ecstasy or something, that's a big red flag. But I also don't want that to be misconstrued or read as, well, if they're not marketing that way, that means it doesn't have fentanyl, because that could be a very dangerous assumption.
Such a tricky path of communication. Thank you for highlighting that. So I think that the short answer to that really is there's no way to tell that a pill purchased not from a pharmacy doesn't have fentanyl in it. Thank you very much for that answer. Where can I find services and drug and alcohol support services in this county? So Dulce, why don't you talk a little bit more about how people access services, particularly for teens and young adults at Aldea?
So there's various ways that we can receive referrals for our treatment services. Some of the times we receive them through school, through probation, but we can actually have you call directly to our office and make a self-referral for your youth. If you were interested in prevention services, you can reach out to the Wellness Center at school as well, or have your youth directly go to the Wellness Center to refer themselves.
Does Narcan expire? And is it something I could just keep in my purse? Followed by, where can you purchase Narcan?
I'll take that one.
So it does expire, like most medications, there will be an expiration date that comes on the box. And it is something that you can just keep in your purse, and that's exactly where I would recommend keeping it, is on your person. So if something happens, you don't have to go search for it. You just know right where to go. And then, so as far as where to get Narcan in Napa County, so you can, there's CVS, Walgreens, and Rite Aid local pharmacies. Just make sure that you call ahead before going there to make sure they have it in stock. There's something called endoverse.net, where the Narcan is free. You can order it. You just have to pay shipping of $7.99. And they, I think you have to watch a video before they actually send it to you. And then there's also Next Distro, which you have to watch a video, answer a few questions, and that will also ship to you in about a week for free. So those are the resources that we have.
So great, really great information. So available in local pharmacies. Directly from the pharmacist. Thank you. You do not need a prescription. You can go to the pharmacist itself. It's not on the shelves. You have to speak to the pharmacist. And then those other resources to access Narcan online will be also shared out as well. Another question, can tolerance to an opioid or other substance be reversed? Oops, my chat box escaped. Lots of questions came in. I'm going to go right back up here. Thank you, Mona, and all the panelists. What else can we do as a community to help? As Dr. Atali said, first, being here is really important to understand more about what the situation is with regard to fentanyl, opioids, and other substances in our community. So that's number one. Talking with your children, young adults in your family and community as well about these issues is really important also. And we can talk a little bit about other events that may be happening, other community events that you may get more information as well. I would say if you have students in schools and your students are in schools and there's a way to ensure that they're accessing education in the school communities as well, and that they're going to those resources that your students and their friends are going and using the resources that are out there, is one way that we as parents in our community can help our students and our children be actively seeking out these resources. Next question. It's a long one. 2 of my kids have fentanyl addiction. I'm so sorry. I advise checking your kids' virtual accounts as the kids buy pills on Snapchat, paying with Cash App or Venmo. Also, every overdose episode that we've experienced required 2 doses of Narcan. 1 just wasn't enough. Can you please drop the links for those resources into the chat? And can tolerance to an opioid or any other substance be reversed when you stop using? Dr. Atali isn't on the call, but I can. I'm a family physician also, and I can say yes, when a person stops using over time, their tolerance does diminish. And I'll be honest that actually in that cycle that Dr. Atali talked about, sometimes when people are in recovery, they fall off their bicycle and they need to learn to get back on the recovery bicycle. However, in that period of when people lose their tolerance and may begin using again during their treatment of addiction, that is a very dangerous time because they often forget that their need for opiates is much less than it was when they stopped using. So the simple answer is yes, people's tolerance to opioids goes away after stopping using over time. It's not immediate, it does take some time, but then that does create another risk for them at the time they may begin to use again during the course of their recovery. Next question, how do we facilitate educational programs for teens in our schools? Are there other organizations that can support this?
I can answer part of that question. So I actually do parent presentations as well, and I've worked with various middle schools, high schools, and elementary schools to do parent education presentations. I'm sure that we could also organize some sort of youth presentation as well. So I would love to come to the school that your youth are at or that you work with to do presentations there as well.
Great, thank you.
Colleen, can I answer part of that question as well?
Absolutely.
Yeah, so part of what we do with the foundation is, well, we just started doing it, but we go out to and give presentations. We did give a presentation Tuesday evening at St. Helena High School to parents. So we can go out and do presentations for parent associations. And then I would just have parents, go to your school principal and ask what they're doing to bring fentanyl awareness to their kids in school. This is affecting middle schoolers as well. I belong to, unfortunately, many parent groups, and these kids that are being poisoned by this fentanyl are 12, 14, 16 years old because they're so familiar with these prescription pills that doctors prescribe, and they see, they're either prescribed it for an injury or they see parents take them, and they feel safe. So they see these pills on Snapchat or social media, and they think it's the real thing. And so this needs to be, really in every drug curriculum in middle school and college. But we are happy to come Napa locally if there's anyone that, would like us to speak about it as well. Thank you.
Great. Thank you, Mona. Really great suggestions. Can I please acquire this meeting recording so we can share with all of Olay? Can someone comment on how and when, if this will be posted on the website at the Napa County or Napa County Office of Education?
This is Rebecca. I'm not sure when it will be posted, but we will have the recording and a message will go out, and we have everyone's emails as well.
Great, thank you. And just a reminder that we had a town hall presentation yesterday in Spanish for our Spanish speaking families. And so both of those will be available, and we'll notify you when it is available. And then also, can we please put the websites for accessing Narcan into the chat? Does Narcan work for methamphetamine or cocaine overdose? No, it does not. Those are completely different drug classes. And so the Narcan is really specific for opioids. I have heard that it's just as dangerous if it's absorbed through the skin. Is this true? There's been a lot of information about this in the press about fentanyl being absorbed through the skin. And I would say that hasn't been, I didn't hear in the information that was presented this evening that has been true for any of our overdoses in Napa. And I don't think it's as absorbable through the skin as it is when ingested, or as many toxic occurrences as when it's ingested. There are medical fentanyl products that are formulated to be absorbed through the skin, so it can be absorbed through the skin, but I don't think it's as simple as you can see. I would like to see Napa put together an annual community event for Overdose Awareness Day on August 31st. Thank you, Mona and panelists. I admire and am grateful that you have chosen this path. I too lost my son to fentanyl poisoning on December 23rd, 2020. So sorry for your loss. And the Napa Opioid Safety Coalition will be looking at the ways in which we can continue to support community awareness. And you raised a really great opportunity for us to highlight community awareness. What are some of the slang words and emojis that are code words for drugs? And how can I be on the lookout if I suspect that my child is seeking drugs?
I can start that one, Colleen. There's different parenting philosophies and different households, but I think we have to know what our kids are doing and what they're up to and who they're chatting with and what's going on their phone to some extent without being overly intrusive on certainly their privacy. But if you do see emojis that are suspicious and they're causing you any kind of suspicion, there's a reason for that. Trust your gut, trust your suspicion. Any pill emoji, especially red pills, but really any kind of medical looking emoji is a big red flag. There's the slangs change all the time, and it could be a slang for something that isn't even fentanyl, right? Good fella, TNT, or some fentanyl slangs, but it could be a slang for Xanax, Z-bars. Because again, that Xanax might have fentanyl in it, and we could have a situation with a poisoning. It could be an oxy slang. Hillbilly heroin is a slang for that. But the kids are pretty creative, and the slangs I just listed could be outdated already. I mean, they're constantly coming up with new slangs and new emojis, and it's just a matter of how much do you want to monitor your kids' communications. And again, as a parent, and I'm a parent as well, I just advise folks, really trust your gut and know who your kids' friends are and know what they're up to some degree.
Great, thank you. Another
Can I
question
just-
that you may be,
Can I just add to that?
of course.
So the Drug Enforcement Agency has a list and photos of the drug emojis that drug dealers use on their website. They have a campaign called One Pill Can Kill. And so the website is dea.gov/1pill. And you kind of go through there and you'll see the drug emoji list. And it'll show photos of, what they use for Percocet, what they use for cocaine, what they use for meth, and things like that.
Great, thank you. Another great resource. Another question, I heard that there are fentanyl test strips that can be used to test drugs. Are these effective? These are certainly available on the market, and I will say that there are likely some of them that can be effective, but I can't vouch for it. I'm curious if there's anyone on our panel who can talk about it. Is there a known test strip out there that's available for purchase to help individuals testing their drugs for fentanyl?
I can start taking that question. There are fentanyl test strips, and they're used, just to detect fentanyl, and it's like a pregnancy test. It looks like that. So you have to dissolve the entire substance in water. So I believe it's one strip says is fentanyl, 2 is no fentanyl. The problem, my personal thing on that is that you have to test the whole substance. If you don't, it only takes so little fentanyl to kill someone. So if you don't test the whole thing, that can be dangerous. The second thing is it only tests fentanyl. So drug cartels are starting to put other lethal, substances in fake pills and other powders. So you have to be very careful. Even if it says there's no fentanyl, it could be something else. But there are fentanyl test strips available. And if anything, it's shown to be a deterrent. So if a college student is testing a substance and fentanyl is, shows up, they won't use it.
Great, thank you for that
Yeah.
addition. What about services for older adults? Unfortunately, I know someone who's struggling with addiction, but is older than 21 years old. In Napa County for adults, we have the Alcohol and Drug Services Program at Napa County. And I'm wondering if someone could put their phone number into the chat as a resource. Also available on the Napa County Alcohol and Drug Services has their own website that you can search in a Google search as well. Any other panelists have anything to add to that? Great, Sheriff Ortiz added that any pill, particularly red, colored pills are red flags. I've lost several friends in Napa to fentanyl, and 2 were last year. It's a very scary drug. That it is. Thank you for sharing. Why are drugs allowed to be sold on Snapchat? Why doesn't law enforcement intervene, such as arrest these drug dealers? Ms. Haley, any comments about that, or Sheriff Ortiz? Anyone have comments about?
Look how quickly he got off when you
Yeah.
said, oh, there he is.
Sure.
Okay. It seems like such an obvious question, right? It seems like such an obvious solution when you see that drugs are being sold on things like Snapchat and so forth. Those are actually very, very complicated jurisdictional issues. I can only prosecute those crimes that take place within my jurisdiction, which is Napa County. Snapchat is not headquartered in Napa County. The drug dealer may not be in Napa County. There's a lot of different there's a lot of different impediments from being able to do a local prosecution from a drug transaction that starts on a place like Facebook, Instagram, or Snapchat. Those, you do see them, they occur in federal court because they are using federal wire transfers and things like that. We don't do them here in local jurisdictions, and they're very evidentiarily complicated.
I would just add that we have had cases. They're hard to do because the drug dealer and the drug buyer often have a trusted relationship already, so it's hard to infiltrate that. But we've had cases where in an undercover capacity, we can buy drugs from a social media platform and have it delivered into Napa County, then thereby giving us jurisdiction to prosecute that drug dealer. But usually it takes a while to get there because there's been some establishment of trust between the drug dealer and the drug consumer. We have seen those kind of cases, we have worked those cases, but Snapchat in particular, some other drugs like Xanax, ecstasy, MDMA, it's a very young people culture, and our undercover cops just don't look young enough. So it's and we don't have any teenage cops. So I mean, it's good for 21 Jump Street movies, but we don't have anybody like that. So it is a very hard community to infiltrate. So, but we have done undercover operations through the undercover social media accounts.
Great, thank you for those answers. How does the Narcan vending machine work? Is it free?
So I have been having extensive conversations with the people that have been doing them in Marin, and they are like ordinary vending machines where you can push A2 and the Narcan kit will fall out of its little, aisle or whatever in the machine. They are free. They come with stickers on them with instructions in both English and Spanish, and there is a QR code that will take the possessor of the kit to a website that has an informational, kind of like what we saw today. This is how you use it. You can take as many of them as you like. Marin has had them, and has had them long enough to have some preliminary statistics. The preliminaries are that each vending machine is dispensing approximately 20 kits a week. Therefore, and so they're good. I think the vending machines hold over 200, but to avoid having any kind of expiration issue, they're giving them about 30 at a time. We're seeing about 20 of them go out a week. And they have just gotten funding for 5 more in their county, which then makes me greedy and competitive because I think they are a good idea. And strategically placing them through Napa County may be just one way that we can start getting Narcan into the hands of the people that need them most.
Great, thank you. And then if you follow in the chat, there's a number of resources for adult alcohol and drug services and for the other service in the connection to the Narcan online, etc. And then I'm just going to read a comment. 2 of my kids actually bought drugs using their phone with phone payment in St. Helena. There are networks of suppliers, even within the local community and so-called friends. The bizarre thing is that once a kid starts using drugs, they will, oops, I'm so sorry. I need to make my chat bigger. Why would a St. Helena High School let all parents know via email that K-9 units could be sniffing the campus for drugs with a 2-week warning that includes date, time, and local event? The network of suppliers, even the local communities and so-called friends. Sorry, bizarre thing is that once a kid starts using drugs, they will always protect the name of who is the supplier. I've been contacted by the St. Helena Police Department 3 times, and they were referred me to Napa County. Why would a high school let parents know via email that K-9 units will be sniffing on campuses for drugs with a 2-week warning, including the dates and times of the event? Calls to question as to whether it cuts the purpose of catching drugs on campus if it isn't done actually randomly. Again, there's another comment in the chat about withdrawal management, such as detox and residential treatment for adults can happen at a place called Centerpoint in Napa. And another question about how is the best way to talk to your kids about fentanyl poisoning?
I can give a theory as to what's going on in St. Helena, and that to me sounds like a lawyer got involved to give that kind of warning. It is not typical of a response that we see. You're right. The whole kind of point is sort of random checks. But I don't have an answer for you. And I don't think anyone necessarily on this panel would for the decision that St. Helena made. That's just my theory as to what's going on.
Great, thanks. When I was in high school, a long time ago from one of our guests, it was also a long time ago that I was in high school. There was a demonstration of drunk driving and death that was presented by law enforcement, really powerful and stayed with me for life. Kids today are smart. It might be useful to bring a task force of high schoolers to help educate their peers on the effects of drug use and warnings of fentanyl poisoning and Narcan use. And just so you know, the Napa Opioid Safety Coalition is working still with other community resources, just like this event, to find out from students, from children, high schoolers, what will be the best ways that we can reach out to them and provide similar education. And then it was discussed that was a death with fentanyl. Also mentioned that no one has been charged. Is there a reason why, if someone has died from fentanyl poisoning, that there hasn't been a charge?
I can answer that. There has not. So the way that criminal charges occur is that the crime occurs, it is investigated by investigators, and the case is presented to the district attorney's office for charges. Notwithstanding the fact that there have been opioid related deaths, there have not been circumstances that have justified the kinds of investigations to bring to my office for a charge of murder. That is a wonderful thing that we have not had that situation happen, although I can assure you that we are prepared and ready in the event that that were to occur.
Thank you so much. It was, is Napa County planning to do more of these presentations specific to youth? And if so, when I think I just answered that question, the Napa Opioid Safety Coalition will be working with the Napa County Office of Education, as well as Public Health and many community collaborators to find out the best venue and the best vehicles to reach our youth and give them a message that sticks and that's really helpful for reducing the fentanyl poisonings. Great question. Does the Good Samaritan law apply to overdoses?
I would need to know more about that question and to be able to answer it accurately. Does that mean that if someone was giving Narcan and touching another person, could the Good Samaritan be charged with battery? I would not find that case to be very persuasive. It would not be natural for our office to charge battery on someone who is trying to save another. But I'm not sure if that is the precise kind of situation you're asking for.
I think I'll wait to see if that person clarifies their question, but I think it might raise a question that does come up at times, that if someone is using drugs with someone else and one person overdoses and that individual administers Narcan and calls 911, can they get in trouble legally for using drugs with that person?
That's a great question. You know, a lot of times our prosecutorial decisions are made with an eye towards, does this prosecution create a chilling effect for good things happening? And we want to live in a community where people feel free to call 911. Are there sets of circumstances where charging would be appropriate? I assume certainly if there's children involved, certainly there can be facts of a case that might justify it. But I want to create a community where we feel free to call 911 so that we don't have panelists like the kinds that we have on this one tonight.
Great, thank you. That the participant sort of elaborated to say, one of my kids overdosed in Petaluma, and the officer told me there, if someone calls in an overdose to 911, they're automatically immune from prosecution. That's the sort of foundation of that question. Great, well, it seems that we have finished with our questions in the chat. There are no further questions in the chat. One more question in the chat. If the drug dealer would be prosecuted for murder, why is it that the person who died of fentanyl poisoning does not have that listed as the cause of death rather than accidental overdose? Shouldn't the cause of death be fentanyl poisoning?
I
Mr.
can
Kuhn?
answer that.
Sure.
Yes, you're correct. It should be poisoning, but unfortunately, the way that deaths are, logged right now, it's not. It's an accident. I actually, when I spoke to the medical examiner from Michael, I told him this was not an accident. This is a homicide. And so there are a group of parents are trying to get that changed. I think there's one coroner in Pennsylvania that just started doing it, listing fentanyl deaths as a poisoning. And so you are correct there. They should be, but they're not, just because of how it's set up right now.
Kuhn, could you talk a little bit about how the cause of death, like specifically in these cases, it's a pretty complicated process, believe it or not. But could you talk a little bit about how that cause of death documentation is a little bit challenged at this time with regard to fentanyl poisoning, overdoses, et cetera?
I'm sorry, was that for me?
Yes, simply because the coroner's office typically is the one that helps manage that piece of creating the document around
Sure.
death certificate.
So ultimately, the cause of death is determined in a combination from who we use here as a forensic pathologist, our doctor, who is the main force behind that, in combination with our coroner investigators. A lot of things are taken into consideration, which would be the entire investigation, the scene where the person was, the circumstances around whatever it was they took. All we can obviously go by is the information that's provided to us. Toxicology alone does not give you a cause of death. It will just tell you levels of whatever substances are in that person's body at the time those tests were taken or at the time they passed. So ultimately, a lot of things can come down to statements, which is what makes it hard on the investigation level as well. But Mona's absolutely correct. If there's information that someone gave someone a pill that caused their death, and criminally aside, on the coroner level, it's a little bit different. A homicide means someone who dies at the hands of another. So someone else who caused that could be classified as a homicide. Now, again, that's separate from the criminal definition of homicide, which you have to have in order to be murder, in order to have it charged, which Ms. Haley can speak to better than myself. But there's a lot of things that come into play, and cause of deaths are different in jurisdictions, and doctors have different versions of how those things can come to be.
Great. Thanks so much for the answer. And thank you all for joining us this evening. We really hope this town hall has improved your knowledge about some of the dangers related to fentanyl and other opioids. And also, we hope that it's also given you some tools to use both at home and in your broader communities to help you take some steps to prevent overdose and death from fentanyl and other opioids. The Napa Opioid Safety Coalition will continue to work to increase access to and education about naloxone across our communities. And we, as we found out this evening, that this is not a simple problem, and it doesn't have a simple solution. It's multifaceted and will require lots of collaborating across organizational community, structural organizations, as well as individual communities working together to provide better education and improve the awareness around opioid use in general, as well as specific fentanyl use in our youth. Please visit the countyofnapa.org alcohol and drug services page for more information, and the Michael Leonardi Foundation website for more information. The websites are posted on our slides, and also have maybe posted in the chat as well. Please also visit the Napa Opioid Safety Coalition at community events when you're out and about in the community. We are aiming to be in the community to provide more education to the general public, and we're looking for further contacts with you. Thanks so much for participating.